Today I'll be talking to you about your arthroscopic surgery. Your exact date, time, and location of surgery will be discussed with you at a future time. This is more of a generic video talking about frequently asked questions. Firstly, there's nothing to eat or drink after midnight the night before your surgery. An exception to this would be any medications that you take for your heart, for asthma, or for psychiatric needs. Always talk to your PCP if you have any questions about your medications that are not related to your shoulder. You may drink water up until 2 hours prior to your arrival time for surgery. Again, this will be given to you at a future date. We want you to stop all of the following medications 1 day before your surgery. Any diuretics, any ACE inhibitors, and any ARBs or angiotensin receptor blockers. Again, please refer to your primary care doctor if you have any questions about this instruction. We want you to stop all anti-inflammatories, including Aleve, Motrin, and ibuprofen, as well as any herbal supplements, including CoQ10, glucosamine chondroitin, melatonin, fish oil, 5 to 7 days before surgery. So about a week before surgery, you're going to stop all anti-inflammatories, including aspirin and any herbal supplements. Important medications after surgery include pain medication. We'll give you this prescription prior to your surgery date. We can also send it electronically to your pharmacy. If you're able to take anti-inflammatories, we'll be giving you a prescription for medication called Toradol. This is only for 3 days, and it helps significantly in decreasing your need for opioids or Percocet or Vicodin. And thirdly, we'll be giving you a medication for nausea. You may not need this, but we like you to have it just in case. Once you get home from surgery, if you feel itchy or you have trouble sleeping, we recommend Benadryl. This is helpful for both of those needs. It's over the counter and easy to obtain. If you have a sore throat, we recommend an over-the-counter lozenge or throat spray. If you feel constipated, which you will if you're taking the opioid pain medication, we recommend an over-the-counter stool softener. The name of it is Colace, but if you have a medication that you use for constipation regularly, that's also fine. Therapy after surgery will depend highly on the type of surgery that you have. In a nutshell, if you have a simple cleanup procedure, your therapy will likely start the day after surgery, and it will be formal physical therapy with a physical therapist. If you have a rotator cuff repair, it's highly variable. You could be doing home exercises only, or you could be seeing a therapist. If you have work done to the biceps without a rotator cuff repair, your therapy again will be specific to that. Sometimes we don't know what kind of therapy you will have after surgery until after surgery. With regard to a sling or immobilizer, again, this will highly vary depending on the type of surgery that you end up getting. You could be in a simple sling for comfort only. You could be in a moderately inhibiting shoulder immobilizer, or you could be in what's called an ultra sling. Again, this depends on the type of surgery that you have. With regard to showering after surgery, your surgery has been arthroscopic, therefore you are allowed to shower 2 days after surgery. What you'll do is remove your surgical dressing, put waterproof Band-Aids over the incisions, shower normally, and then replace the Band-Aids with new dry ones. With regard to bruising and swelling, this will happen, and it varies depending upon the patient. With regard to swelling, it is inevitable. We need to pump the shoulder full of fluid so that we can see, and then your body needs to absorb that over time. It may go into the chest, the elbow, the hand. This is completely normal, and it will resolve over time. With regard to an ice pack, You will wake up with an ice pack or an ice machine on your shoulder, and you'll go home with that. We encourage you to use it as much as possible for the first week, and after that it's for comfort only. With regard to sleeping, you're allowed to sleep in whatever position you're comfortable as long as you are compliant with whatever sling or immobilizer you have on. So if you're in a black ultra sling with a pillow, we're probably going to want you to be in that for 6 weeks, 24/7. So that means you have to sleep with it. If you're more comfortable in a recliner, that's fine. If you're comfortable flat on your back, that's fine. Just keep that immobilizer in place. Same thing goes for the blue immobilizer with the Velcro straps. Don't worry too much about it right now. We'll talk with you more specifically when we speak with you right before surgery. Thank you for your time. We know this is a highly anxious time for you before surgery. We are here for you. You can call the office or email us, and we'll be happy to answer any of your questions.